Have you ever injected filler right in front of the ear? Hear me out. The preauricular region is this region right here. Pre meaning before, auricular meaning having to do with the ear. So the preauricular region is located right here in front of the ear. And as we age, we begin to experience bone loss and the descent and deflation of our fat pads, creating this sunken and hollow appearance, losing that kind of youthful contour to the face. Understanding these aging changes is really crucial. It explains why even subtle enhancements in this area can make such a dramatic difference in facial balancing and bringing back that youthful contour to the face. For the preauricular region, my product of choice is hyperdilute Radiesse. I love this product because I can dilute it down and really give a powerful biostimulatory effect. I typically like to do 1:3 or 1:4 ratio, meaning 1 part Radiesse, 3 parts saline, and you mix it in and blend it down and dilute it down so it spreads so beautifully. It gives this smooth, even distribution in the tissue, but understanding your dilutions is powerful with this treatment. Meaning, if it's a patient that has more youthful density to their skin, somebody maybe like me, I'm not youthful, but I have some density to my skin, I can tolerate a 1:3 dilution. Now, if you have a more mature patient, with thinner tissue, a 1:4 dilution would be more appropriate. Really understanding, and you learn this just through experience, to be honest, learning tissue densities and learning how that radius behaves in different types of tissue. But I will typically stay between a 1:3 or a 1:4 dilution. This gives At this dilution, you're not really getting a powerful G prime. You're not really getting volumization of this area. You're truly just getting that biostimulatory effect and that regenerative effect where they're stimulating collagen type 1, type 3, and elastin. So I absolutely love this product. It's my go-to product, and I'll typically perform a treatment and then 4 to 6 weeks later bring them back and repeat the treatment, or I might transition them to an HA filler. It really depends on the patient, but I do typically stay between a 1:3 or a 1:4 dilution for this treatment. Now, when it comes to technique, it is crucial for this treatment. I mean, technique, let's be real, is crucial for every treatment, but this is a delicate area because you remember we have that structure called the parotid gland in this area. So making sure that you're in the appropriate plane of injection is key to avoiding that parotid gland. As far as vasculature, we have the transverse artery sitting below the zygoma. And if you get low enough with this treatment, you have to remember you have that facial artery tracking out of that antegonial notch. So making sure that we understand our anatomy and what plane of injection we're in. I typically like a more superficial injection using cannula. 25 by 2-inch cannula is my go-to for this treatment. And I sit more dermal, subdermal with my injection plane to stay above that parotid gland. You can see here in this video, I'm placing small retrograde threads. I'm always checking to make sure my depth is okay. You could see I'm lifting the cannula, and I always want to be superficial to avoid that parotid gland. Also, another reason why I like to inject more superficially in the dermal subdermal plane is because that's where the fibroblasts live, and that's how you're going to get that biostimulatory effect. So here I'm placing nice retrograde threads, again at a 1:4 dilution with this patient. I'm not worried about leaving massive thick caterpillars that I have to massage down. With this dilution, it's going to spread like a beautiful blanket in this area, laying nice uniform threads. I never inject moving forward. I always inject retrograde. I'm going to add a little bit in the jawline with my go-to cannula being 25 by 2-inch cannula. I love this cannula. I feel safe. I feel comfortable. I think it's sturdy enough. 27 gauge tends to be a little too flexible, so I get a little stuck, especially if they have a history of surgery in this area. They might have some scar tissue, so you want a little bit more of a sturdy cannula. Some people prefer a 22 gauge. It's all about understanding your tool, your paintbrush, and being comfortable with that. So for me, 25 by 2-inch, nice retrograde threads, and then I'm going to spend time massaging that product down, but you can see how it just lays beautifully. I don't have any lumpy bumpies. I'm not concerned about that. I will tell her that she'll be a little bit sore after this treatment, but for the most part, it's fairly comfortable. and her pain tolerance, I mean, she has a great pain tolerance, but I would say maybe a 2 out of 10 if there's any discomfort at all. It truly is such a beautiful, beautiful treatment when you're starting to experience that hollow and sunkenness in the preauricular region. Now, if you're interested in deeper information, I have a full jawline book where I actually have in the video portal a step-by-step video injecting the preauricular region with hyperdilute Radiesse, and I also walk you through step by step how I actually perform the dilution and mix the Radiesse itself. If you're loving these videos, please hit subscribe. Help me get to 1,000 subscribers. That's my goal for this year, but thank you for tuning in. If you have any questions, comment below. I'm an open book. Don't hesitate.